I just wanted to say this is a press conference, so I'm going to be leading this. My name is Zach Gregg. I'm one of the organizers of Lancaster Stands Up. So if you are a reporter on this call, we're going to have time at the end for you to ask questions of our speakers. So everybody else is going to be muted and will not be able to speak, but we will have time during the commissioners meeting that you can make comments. And again, we're only taking questions from the press. And if you are press and you are on the phone, I would ask you to please click the link so that you can join and that we can see you, so that way you can type in the chat when you have a question. And also, we are going to be recording this call and posting it to our Facebook page so that anybody that is not able to join us can watch this, or if other press would like to watch this afterwards and have questions, they can do so. So once again, thank you everybody for coming, and I'm going to kick this over to our first speaker, Eliza Booth.
Thanks, Zach. Good morning, everyone. On Sunday, in a letter addressed to Governor Wolf, Republican policymakers at the county and state level made public their intention to disregard the consensus of doctors, medical professionals, and scientists in order to prematurely reopen Lancaster County before it is safe to do so. In disobeying the governor's executive stay-at-home order, these politicians are risking the lives of their own constituents in attempt to score political points. Staying safe and saving lives did not have to be a partisan issue. Cynical politicians and political operatives are making a choice right now. In a moment when we need to stand united in the face of a common threat, they are recklessly dividing us. In a moment when we need leadership, they are instead making political calculations. Working families should not have to choose between going hungry and risking contracting a deadly virus to put food on the table. Instead of prioritizing our lives and providing necessary economic support for working families, they're forcing vulnerable people to return to life-threatening workplaces before it is safe to do so. I am a lifelong resident of Lancaster County, and currently I know 5 people who have COVID-19. None of them live in nursing homes. One of them is my neighbor and friend and fellow Lancastrian who has been a great neighbor for the past 15 years. He is currently in LGH on a ventilator, and his major organs are failing. The prognosis is grim. His wife of 30 years cannot see him, and we are all heartbroken. This virus is deadly and causing great harm to our county and its citizens. Every public official in this crisis has a choice. Put aside partisan opportunism and protect the lives of your constituents, or exacerbate the devastating impact of this deadly virus. Prematurely forcing people back to work will deepen the severity of COVID-19 pandemic and lead to more illness, death, and economic catastrophe. We cannot allow this to happen. In this moment, Governor Wolf is standing with the people of Pennsylvania by naming consequences for counties and municipalities where politicians are putting people in grave danger. We are livid that our elected representatives in Lancaster County are responsible for adding Lancaster to this list of counties because of a reckless stunt. Today, directly following this press conference, Lancaster County Commissioners will have their weekly meeting open to questions via public stream. We are calling on everyone in Lancaster County to join this virtual public forum and to hold our county commissioners accountable. 2 of our 3 county commissioners, Joshua Parsons and Ray D'Agostino, signed Sunday's letter. Last week, they released a plan for spending the $95 million in emergency aid Lancaster County received nearly 3 weeks ago. The commissioner's own plan which includes critical capacity for COVID testing and safety measures for places of business, will not be ready to be implemented by this Friday, the date they plan to reopen Lancaster County. We demand that our commissioners, State Senator Scott Martin, Congressional Representative Lloyd Smucker, and the rest of the elected officials who signed that letter reverse their illegal, reckless, and dangerous decision to prematurely reopen Lancaster County on May 15th. In a Facebook post yesterday, Commissioner Parsons claim to be advocating for the working class, but it is frontline workers whose lives are at risk by forcing them back to work before measures to protect them have been implemented. Allowing businesses to reopen with insufficient measures to protect workers is not advocating for the working class. It will literally result in the preventable deaths of many more working people. Our lives are at stake. We will not allow politicians to turn our survival into a partisan issue. We are all in this together, and we need leaders who will step up and lead. We are inviting all Lancaster County residents to join us for a honk and drive protest in Lancaster City, where we will be driving by Senator Scott Martin's office and Congressman Lloyd Smucker's office to demand they put our safety first. That will be this Friday at noon. We will be sending route and logistical details out later today, so stay tuned for that. We also invite everyone to be involved as you possibly can be right now, even from your home. Call your elected representatives, write letters to your editor. It is up to us to hold our elected leaders accountable.
Thanks so much, Eliza. Next up, we have Lillian, who is currently a healthcare worker working in a local nursing home. Lillian, take it away.
You see me? Okay. Good morning. If you can see me, you can see this is how we greet our residents. This is nursing's new normal, unfortunately. This is how we have to greet them. This is how we have to feed them. This is how we have to take care of them. This is not fair to them. They need to see my smile every day, and I need to see theirs. It's dangerous. It's a very dangerous situation we're going through right now. We don't bring the COVID into our facility. We bring the COVID into our facility. Our residents don't go out and get it. They don't leave. They're there every day. Our city is not safe. The country is not safe. It's not safe. It's not safe to open up anything. Everyone needs to stay at home and stay safe. This is not safe yet. Not at all. I fear for my residents every day. Every day I fear for them. That someone's going to bring this horrible disease into our building again and infect someone else. I've seen people die. I've seen my residents die. I've actually put, 4 of my favorites in a body bag this year. They would have had more than 10 years to go, but because of this horrible disease, they didn't make it. I just want them to keep everything shut down and safe until it's time. It's not time. It's not time. My cousin's having surgery. I can't, because of this, even go with her to hold her hand. She has to wake up without me. It's very scary. Very scary. How are they opening up these counties and it's not safe yet? No one's on the same page. You know, listen to the medical professionals that they're telling us right. Keep everything shut down. Trust me, I'm on the front. I see it every day. I check people in and out. At my job, I'm checking people in and out. I've had 8 coworkers, 8, go out in just 1 week, with more to come. This is not over. It's far from over. Far from over.
All right, Lillian. Well, we really appreciate you taking the time to say all of this and really relaying how serious this is.
It's very serious. I haven't until last week, and I worked 46 days in a row because we didn't have staff.
And that's why we're really glad to have you here to relay that. In the interest of time, I'm going to keep things moving, but we really appreciate it. Next up is Dr. William Fife. He is the City Board of Health Chair. I think you're muted. There we go.
Thank you, Zach. And thank you for sharing your stories, Elizabeth. And thank you for the opportunity to speak about the public health aspects of COVID-19 or coronavirus in Lancaster County. Coronavirus has brought tragedy, hardship, and misery to many. I have seen my patients die, lose loved ones, lose their health and function, and lose their livelihood due to the virus. When the virus first started to infect those in Lancaster, I was very fearful of the incredible impact that it would have on my patients, my coworkers, and my community. Predictions of a surge more than double the number of patients that our own hospital could usually care for drove me to learn how best to care for my patients with COVID-19 and adult respiratory distress syndrome. Fortunately, this surge did not come, but there are still many in Lancaster who are sick and dying of COVID-19, like those you just heard about. But I am thankful to all those who've been seriously abiding by CDC recommendations, which prevented such a surge. Every day I speak with patients diligently following social distancing measures. They're washing their hands frequently, they're wearing masks, and they're staying home. Doing this in time is what kept our hospitals from overflowing. Many people from dying unattended at home, as has happened in many places not very far away, like New York. And it's also kept my coworkers from getting sick and dying. This has certainly come at a cost. People forced to stay at home, people without adequate income for food and rent, people afraid they might become sick and might lose or have lost their jobs or businesses, children and young adults losing opportunities in education, friendships, sports, loss of important shared events like graduations, weddings, funerals, and proms. Many of these definitely have serious impacts on health and well-being. I strongly believe we do need to allow businesses to open, education to be restored, and increased human interaction. But the virus is still very active in Lancaster, with 623 new cases in the last 2 weeks. In order to decrease the risk to you, to your loved ones, of dying from the virus, this must be lower before we begin opening up. And opening up must be done in a coordinated and a safe way. After trying to learn as much as I could about caring for patients with COVID-19, and as Lancaster was fortunately not experiencing an overwhelming surge, thanks to the lockdown, I shifted my efforts towards trying to prevent people from becoming infected. A model that has been referenced by the White House has been South Korea. This week, the White House focused on the US success with testing, specifically that we surpassed South Korea in the per capita number of tests for our country. But testing alone was not a successful strategy employed by South Korea. Yes, they tested, and they tested early, but they also did much, much more. They did contact tracing. That means for every person who was infected with COVID-19, they found all the others with whom they had been in contact when they were infectious. They then quarantined all of those contacts and isolated all of those with COVID-19 until they recovered and were no longer infectious. This is what allowed them to stop the spread of the disease and maintain other activities like businesses, schools, worship, and even enjoying food at restaurants with friends and family. In a population about 100 times the size of Lancaster, 100 times the size, South Korea has experienced almost the same number of deaths as we have in Lancaster. In both places, the deaths are tragic. But if we had a public health infrastructure similar to the one in South Korea, when COVID-19 began to infect people in Lancaster, we would still have 238 of the 240 loved ones, friends, neighbors, mothers, fathers, brothers, sisters, grandfathers, grandmothers, still with us. They would be still with us. Very sadly, we cannot go back in time. But I think we need to put in place a similar system here in Lancaster County. We need the city, the county, the state, the business community, and the healthcare community to coordinate an effort to build a public health infrastructure, to trace cases of COVID-19 and their contacts, to keep us all safe and get us back to work and the joy of being together. Unfortunately, the State Department of Health is overburdened by the toll of COVID-19 and unable to do this type of work for all the citizens of Lancaster. They have had to focus their efforts in Lancaster on congregate settings, such as the nursing home you just heard about, hospitals, and group homes where there can be very large outbreaks. So in Lancaster County, at this time, there are only 2 organizations doing this important work: Lancaster Health Center and the Lancaster City Board of Health. Both are working in Lancaster City. Lancaster Health Center, our local federally qualified health center, began contact tracing early in the pandemic under their public health mandate. They diverted their own resources and began contacting their patients with COVID-19 and anyone with whom they had contact while they were infectious. They should be praised for their early and continued efforts. The Lancaster City Board of Health, a volunteer organization with the assistance of the mayor's office, appealed to the Commonwealth of Pennsylvania to give us the authority to do contact tracing. A little over 2
Bill,
weeks ago.
just in the interest of time, I'm going to keep this moving. We'll have more time at the end if any reporters have questions. But really appreciate you.
I have to actually go. I have to go take care of patients. Zach, I have like 2 minutes or a minute to go. I have to go take care of patients, and the end is kind of important. You okay with that?
Please, yeah, please finish.
Yeah, Rachel Levine and the Commonwealth of Pennsylvania gave the Lancaster City Board of Health authority to trace contacts of people with COVID-19 infections and quarantine them so they will not infect others in our city or county. Lancaster was the first municipality in the Commonwealth to ever receive this authority. We've been working with the city government to build an infrastructure to make this happen. For the last week and a half, myself and other volunteer healthcare providers have been calling contacts in their spare time, providing them confidential counseling on symptoms to look for and ensuring that they have resources to be quarantined for 14 days since their last contact with someone infected with COVID-19. Today, newly trained city workers will begin this work. This work is just starting, and there's great need to help those who are quarantined and isolated to have food, rent, and other basic necessities to stay at home and keep us all from getting sick, hospitalized, or dying from COVID-19. I hope that the county government can use some of its federal resources to provide these things and solidify this important program in Lancaster City. However, there is no one in the rest of Lancaster County performing this vital function to keep us safe. There's no one else doing it. The virus does not stop at city lines or follow any human-made boundaries. So to open the county safely, this must be established in the county. For all of us in the county to go to work, school, daycare, shopping, restaurants, places of worship safely, contact tracing must be in place along with safety measures in the workplace, like continued social distancing, adequate supply of personal protective equipment and sanitizers, public health instruction on how to creatively retool and reschedule work, school, business, and worship environments so that we can maintain safety. I hope the county government and others in the county will recognize their important role to preserve the lives, health, and livelihood of all Lancastrians. Thank you. Sorry, Zach, that was a little long.
No, we appreciate it. That was really important.
Yeah,
Thank
I
you,
actually have
Dr.
to go
Fife.
take care of patients. So I'm not gonna be here for the talk afterwards. But thank you for doing it. And thank you for all those people who are still providing care and resources for people with COVID and those who have to stay at home. Have a good day.
Thank you, Dr. Fife. And lastly, I'm going to introduce the current president of Lancaster City Council, Ismail Smith-Wadow.
Great. Hey, can you hear me, Zach? Good, we're good to go. Hey, thank you. Good morning, everybody, and thank you for being here. And I want to give a special thank you. I know he's gone, but to Dr. Fife for the work that he's doing with the City Board of Health. As he mentioned, the city actually starts making contact tracing phone calls right now this morning. And that is to say, I think we're doing what we do best, taking in hand the resources that we have and turning them to the needs of our community. But I really wish that it didn't have to be that way. This was an issue that needed countywide leadership for all. I'm sorry, am I still?
No, we can hear you.
Oh, okay, good. Sorry. No, this was an issue that needed countywide leadership, especially as CARES Act funding was directed at the county level. It didn't reach the city directly, so we don't have anything like this $95 million pool that the commissioners have to work with. And it's really not the amount of money that's the question. It's the amount of leadership. And I think we all know that we're going through a remarkably challenging time. We can't see our loved ones. A lot of us can't go to school. Many of us can't go to work. And in even more danger are those of us who have to go to work right now. Nurses, other healthcare workers, doctors, grocery store workers, the people that bring us our food, all the things we need to survive. These workers are all still going to work. And in Lancaster County, I think we have a strong sense of values and ethics like anywhere else in America. And as a student of American history, it's my distinct impression that we don't want to be lied to. What we didn't want to happen in this situation was the commissioners to come in and say, oh, this isn't really a problem. Oh, the data says a thing that it actually doesn't say. Oh, we're not worried about this. What we wanted was, as in every other time in American history, we've overcome a great challenge. We wanted our leaders to say, look, there is a serious problem, but because of who we are going to get through this together. Everybody is going to pitch in and work hard to make sure that we can all stay safe and stay healthy and return to what's actually great about our country. But instead, what we got was a four-pronged plan with nothing behind it. And the most disappointing thing about this is that the letter to Governor Wolf indicates that we are actually in agreement with the county commissioners. We do need community-wide testing and contact tracing. We need businesses and essential workers to have as much personal protective equipment as they need. But we're not going to have it by Friday. A contract has not been signed to do contact tracing. And if the commissioners are sitting on a massive stockpile of personal protective equipment that they haven't told us about, I'd certainly like to hear about it. But the truth is that they're not. So let's not treat Lancaster County's residents like children. Let's not lie to one another. This is hard, and it's going to continue to be hard. But because of who we are, we can overcome this. And every moment that our commissioners spent getting into petty fights with Governor Wolf on Twitter could have been a moment where they were actually securing these needs for us. And I think that's the thing that I really want to close with. I know that we do have some time constraints here. But the thing that most got me yesterday was when the chair of the County Board of Commissioners, Joshua Parsons, claimed to be a member of the working class. Now, Josh may indeed have grown up here and may indeed have worked a number of difficult jobs. But here's the truth. Joshua Parsons makes six figures just on his government salary, to say nothing of investments, to say nothing of an adjunct professor position, or anything else like that. Joshua Parsons was previously the clerk of courts, and before that, a prosecutor in the district attorney's office. Again, what we don't want is people to lie to us. Don't pretend to be broke. Don't pretend that you go and work in a factory every day. Just stand up and support the people that work in the damn factory. And the way that you do that is not by grandstanding about the protective equipment. You actually deliver it. That's what we want from you. Josh, Ray, if by chance you're watching this or you ever go back and look at it, what we want from you is to actually deliver. We want to be able to move to the yellow phase. We want to reopen. We want to hug our goddamn loved ones. And we are waiting on you to help us deliver that. The city of Lancaster stands ready to work with you whenever you are ready to actually work together to get this done. Because there are 500,000 people in Lancaster County relying on us to do exactly that. So yeah, and I think that's where I am with it, and I hope that that's where everybody else is with it. And just as I close out my time, I do want to encourage everybody to not just sign up and live stream into the commissioners meeting, but email them your thoughts at commissioners@co.lancaster.pa.us. Make sure they know, and if you think you've written a really good email, send it to the newspaper too. Don't let anybody forget how they failed to show up in this time of most need. Make it a matter of public record because it is a matter of public health and welfare. Thank you.
Thank you so much, Councilor Smith-Waddell. For this last little bit, we have a couple minutes. If there are any press in the room, we're going to give some time for y'all to ask some questions. Again, we're only taking questions from the press at this time. So if you would like to ask a question, I will be taking them and I'll be getting them so that you can ask. If you want to ask a question, please type in the chat your name and the outlet that you are with. And we have a few minutes for this, so. I'm not hearing anything. I'll give it another 10 seconds. Okay. And again, this whole press conference has been recorded so that you can share it. If you're just watching, you can share it with folks that you know. If you are a reporter or you see this later, you are welcome to reach out to any of us to ask a question. But I really just wanted to thank everybody for being here. I wanted to thank our speakers, Eliza Booth, Ismail Smith-Waddell, Dr. Fife, and Lillian. We really appreciate all of your perspectives. And as Izzy said, he took the words out of my mouth. Make sure to attend the commissioners meeting, which is starting at 9:15. So you have about 15 minutes. You can go get your breakfast and then come back to your computer. And I just wanted to reiterate what Eliza said. We're inviting all Lancaster County residents to join us for a honk and drive protest in Lancaster City on Friday at noon. We're going to be driving around Senator Scott Martin and Representative Lloyd Smucker's office to demand they put our safety first. And again, that's Friday at noon. We're sending route and logistical details out later today. And we also invite you to be involved as you can right now. To repeat what Izzy said, write to people, make sure this is a matter of public record, make sure that we know where they stand. We have a chance right now to make sure that we stay safe and that we keep our loved ones at home and that we keep our kids fighting for the future. So again, thank you everybody so much. And with that, we will hopefully see you in 15 minutes at the commissioners meeting.
Thanks, everyone. Stay safe.
Thanks again, everybody.